Message from the Senate, Madam Speaker. I hereby announce that the Senate has concurred in and adopted the report of the Conference Committee on Senate File Number 3472, an act relating to state government. The message is signed Cal R. Ludeman, Secretary of the Senate. Winkler moves that Joint Rule 2.06 relating to conference committees be suspended as it relates to Senate File Number 3472.
The member from Hennepin, the Majority Leader, Representative Winkler.
Mr. Speaker, members, this waives the 12-hour rule for consideration of conference reports, and I ask for your yes vote.
Any further discussion? Seeing none, all those in favor, please say aye.
Aye.
Aye. Those opposed, please say no.
No.
The motion prevails.
Conference Committee report on Senate File Number 3472, an act relating to state government extending the operation of the Minnesota Premium Security Plan. The report is addressed to the Honorable David J. Osmick, President of the Senate, the Honorable Melissa Hortman, Speaker of the House of Representatives. We, the undersigned conferees for Senate File Number 3472, report that we have agreed upon the items in dispute and recommend as follows. The report is signed by 5 of the 5 conferees on behalf of the Senate and 3 of the 5 conferees on the part of the House. Stevenson moves that the report of the Conference Committee on Senate File Number 3472 be adopted and that the bill be repassed as amended by the Conference Committee.
I recognize the author, the member from Anoka, Representative Stevenson.
Thank you, Mr.
Who will
Speaker.
explain the report.
Thank you, Mr. Speaker. That is my motion, and I would ask members to adopt the report. We had a very good conference, and I'm very thankful to the members from both chambers and both parties for their help on this conference. We had a bill that came out of the House that reauthorized the reinsurance program, but we wanted to save the funding for a later discussion, and we wanted to make a series of reforms to address not just premium increases, as reinsurance does, but deductibles, copays, and some of the other issues in the individual market. What we are coming back with, the Senate, by contrast, funded the program for 5 years and did not include those reforms. The compromise that we come back with is that we're funding reinsurance for 2 years up front and 1 year in the tails, so for a total of 3 years. And we have a couple of good reform options relating to postpartum care and prescription drugs that I think are important and will help and make people's lives better. We also are working to hold Minnesota Care harmless from operation of the reinsurance program until, as we expect and hope, the federal government fixes the law that unfairly punishes Minnesota for our work, in which case we will then have a flush health care access fund because this bill does transfer $174 million into the health care access fund. This bill is not everything I hoped it would be, but it is important that we pass it because we have Minnesotans all over the state that are relying upon us to make sure that their premiums don't rise out of control. And the reforms that we adopt in this bill are also important and will help Minnesotans. And so with that, Mr. Speaker, I certainly would ask members to support the conference report and to adopt the conference report.
Is there any discussion on the motion to adopt the Conference Committee report? I recognize the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. Well, I would urge the body to reject the Conference Committee report. And I think Representative Stevenson gave a fair but partial explanation of what went on, and I'm one of the members who voted against the conference report along with Representative Schultz. So, members, I don't think we need to talk too much about what reinsurance is, and we've had a lot of that debate here before on previous occasions, but in the bill that passed off the floor here, there were, and which I voted for, there were some things in there that made it palatable for me. Somebody who doesn't think reinsurance is a very good policy, I frankly think it's the wrong way to go. But I voted for that bill because it had in it some potential. It had some possibilities about where we might go beyond reinsurance. Reinsurance itself is just a bridge to nowhere. We keep reauthorizing it, we keep refunding it, And right now, it just looks like that's all we're ever going to do. Just keep giving money to insurance companies so they don't have to carry all the risk, which is, after all, their business to carry the risk of people getting sick. And instead, we're putting that onto the taxpayers. So in this bill, there were a number of things which the Republicans in the Senate said no to that I think would have made this a decent bill, notwithstanding my continued dislike of reinsurance as a policy. So there was a provision in the bill to hold insurance companies accountable on the issue of mental health parity. So folks here may know that the law requires parity for mental health and other kinds of health, and it often is simply not followed. And there was a provision in the bill to hold the insurance companies accountable. The Senate Republicans refused to do it. There was another piece in our bill that was about getting a report on how to get insurance companies out of our public programs. And this is something members who've been around have heard me probably talk about this for at least 10 years about, and I know there's agreement across the aisle too, that we have unaccountable managed care organizations who are delivering care or at least managing the money in our public programs. We don't always know what they're doing. We don't really know where the dollars are going and all of that. And there was a little report in here to have the Department of Human Services start working on giving us some options there and helping us figure out where we might be able to go. Nope, it's not in there. Republicans in the Senate refused to do it. There is a proposal to explore the public option, give consumers a choice. Maybe they could get out of the clutches of the private market, which is serving them so poorly. But Republicans in the Senate did not want to give consumers that choice. They refused to entertain that proposal and just said no. So besides that, members, there is really nothing in this bill that does anything about health care. I want to be very clear about that. This is all about insurance. And we all know you can have lots of insurance and never get any health care because you still can't afford it.
Members, please mute.
So I hope that's not directed to me, Mr. Speaker. Probably is. Anyway, I will take the cue. I think I've said pretty much what I need to say. I don't want to belabor it, but these are reasons that I voted against the conference report and that I would urge the body not to adopt. So I think, Mr. Speaker, I would just ask before I sit down if you will make it clear to the body after the members are done speaking on the adoption what the meaning of a yes or a no vote is. So thank you, members.
Further discussion to the motion to adopt. I recognize the member from Goodhue, Representative Haley.
Thank you, Mr. Chair, and thank you, members. Thank you, Chair Stevenson, for your work on this bill. And I rise in support of this program. I've been an advocate on lowering insurance costs for Minnesotans all across our state since I first got here in 2016. So I want to clarify or I take issue with something that Chair Liebling said. And first, let's just understand, insurance can be provided by an employer, and employers are governed by both state and federal regulations, and they have certain flexibility, but they also have mandates on their programs. And then there's people in our state that are covered by government insurance programs. And frankly, those government programs, the government tells the providers, the hospitals, the doctors, what they are going to pay, what they are going to reimburse. So the government is setting those rates. So then that leaves individuals in the individual market. That's what this bill applies to. And those individuals are the small business owners, the entrepreneurs, your corner, auto body shop, your farmers. Those folks are left to buy their insurance on the individual market. And frankly, their rates are higher because they're subsidizing a lot of our government programs. But let me tell you then, their claims, they're paying their claims. This isn't checks to insurance companies. Claims for their services are being paid, and then for these really high-cost claims in a gap, in a ratio of 50,000 to 250,000, then some of that is covered by reinsurance. And that's what stabilizes the market and helps bring costs down for all Minnesotans. So what are these types of claims? I want to tell you who we're covering. We're covering diabetes. 700 Minnesotans with high-cost diabetes claims. We're covering heart arrhythmias. We're covering metastatic cancer. We're covering heart failure. We're covering respiratory arrest, rheumatoid arthritis, lung, brain, other severe cancers, pediatric leukemia. Those are the types of things that we are covering for Minnesotans who get into medical situations that have extreme high cost. But again, their bills are being paid, and then reinsurance covers this high-risk gap. If we did not have reinsurance, 15,000 Minnesotans or more might go without insurance. That is directly from the department, from the Commerce Commissioner. That's not my number. So with this bill and this concurrence tonight, you are helping to bring stability to a market, and you are helping 160,000 Minnesotans have insurance coverage that doesn't increase 25 to 38% next year if we did not pass this tonight. And lastly, I want to tell you where the majority of those Minnesotans live that are covered by reinsurance. The majority actually live in rating area 8, and I'm going to give you a number. Rating area 8 happens to be the metro, which most of you on the other side of the aisle represent. So most, I can't get to my right page here. Here we go. Rating area 8, 55% of reinsurance claims come from the metro area. These Minnesotans are from every region in our state, but the majority are from the metro. So those are Minnesotans whom you represent. So thank you, Madam Speaker, for the opportunity to speak in support of this, and I urge concurrence and a yes vote.
Further discussion on the motion to adopt the conference committee report. All those in favor of adoption of the conference committee report, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The report is adopted. The clerk will give the bill its third reading as amended by conference.
Third reading, Senate File Number 3472, as amended by conference.
Third reading as amended by conference. Discussion to the bill. The member from St. Louis, Representative Schultz.
Thank you, Madam Speaker. Well, members, I'm going to vote no on this passage on the bill, sorry. I'm a no vote because the provisions that I supported that were in the House version of this bill have been dropped in conference committee, and I voted no in conference committee because we still have a bill that is a bridge to nowhere. There is no destination. We're spending $890 million to subsidize health plans, and we still don't have a solution to reduce the healthcare costs for consumers. There is no solution. The second reason I'm voting no is because the specifics, how this reinsurance works, is very different from what other states are using for reinsurance. We have an attachment point of $50,000, so every claim over $50,000 is being paid from this reinsurance pool that's being funded by taxpayer dollars. Other states use different funds using fees on the industry to subsidize the premiums. We're using taxpayer dollars. And we should be directly giving subsidies to the consumers, those purchasing health insurance, not to the plans. Then they will know exactly how much they will have to subsidize their own premiums. We do not know the reduction in this reinsurance bill of premiums from the plans. We do not know what that reduction will be. There's no guarantee. Lastly, reinsurance does nothing Nothing at all to reduce deductibles, which are very high for individuals, or cost sharing. Nothing in reinsurance. Buying into Minnesota Care is a cheaper option than reinsurance. And last year, off this floor, we passed a bill, a historic investment, Health and Human Services bill, and in that bill, there was a gem of some language that fixed what's called the family glitch. It allows employees who have health insurance through their employer, if it's more than 9.8% of their income and they have family coverage, they can buy in to Minnesota Care. That was passed. It passed in the Senate. So now that option exists. We simply need to expand that to more people, small businesses, farmers, entrepreneurs, and they will have affordable health insurance. But that's not in this bill. And so, members, I'm voting no because this is still a bridge to nowhere. Thank you.
Further discussion to the bill. Seeing none, the author of the bill, Representative Stevenson.
Thank you, Madam Speaker and members. I think that there was pretty wide agreement when we had this bill on the floor before that reinsurance was a bridge, a Band-Aid, whatever metaphor you wanted to use. And it's unfortunate that we don't have a bill today that provides us the destination point of that bridge. I wish it did. But I don't know that voting no today solves that problem. What voting no today does is it will hurt people all across Minnesota very badly this fall when premiums go up. 167,000 people. And, I'm not a math guy, I'm a lawyer and a prosecutor, but the tax chair pointed out to me that there's 134 of us. He is a math guy, so that's, a little more than 1,000 people in each district here. So 1,000 people plus in each of your districts who are impacted by the program we're talking about here. And we actually do know how they're impacted. We have very smart people working in the Department of Commerce for us. We're very lucky. Representative Lilly had the great employee contracts bill last, I don't know, was that a week ago now? But those very smart people ran some numbers for us. And it's hard to say average or this because insurance premiums vary by region and by person, by age. But we did find in this report that I got here a range. And the cheapest person to insure in the individual market would be a child living in the metro. With reinsurance, a bronze plan for them costs about $2,000. Without reinsurance, it would cost about $2,500. So it's a $500 premium increase, okay? 25% increase just by operation of reinsurance. But on the other end of the spectrum, you have a 64-year-old in Rochester on a gold plan with reinsurance, it's $18,600. But without, it's $23,200. That is a massive increase. And there are people all across the state who will be experiencing those massive increases if we don't support this bill tonight. That's the vote that's in front of us, along with those important reforms on copays and on postpartum care. So members, I would ask for a green vote today.
The clerk will take the roll on the bill. Members, please vote. Members, please vote.
Tell her hi. Yes, sir.
Will the chief clerk please call the names of the members who've not yet voted?
Berg. That's right. Berg, aye. Bernardi. Bernardi. Bliss.
Bliss, aye.
Bliss, aye. Bo.
Bo votes aye.
Bo, aye. Davids.
David votes aye.
David's aye. Davney. Davney, no. Franzen.
Franson votes yes.
Franzen, aye. Green.
Green, aye.
Green, aye. Greenman. Greenman, no. Hamilton.
Hamilton votes aye.
Hamilton, aye. Hanson, J. Hanson, J, aye. Hassan. Hassan.
On aye.
Hassan, aye. Houseman.
Houseman, no.
Houseman, no. Listagard.
Listagard, aye.
Listagard, aye. Lewick.
Lewick, aye.
Lewick, aye. Moeller.
Moeller, aye.
Moeller, aye. Munson.
Munson, no.
Munson, no. Nelson, N.
Nelson, N, aye.
Nelson, N, aye. Olson, B.
Wilson, B, aye.
Olson, B, aye. Sandell.
Sandell, aye.
Sandell, aye. Schumacher. Schumacher. Sundin.
Sundin votes aye.
Sundin, aye. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, aye.
Thompson, aye. Erdahl.
Erdahl, aye.
Erdahl, aye. Bernardi. Bernardi, no. Schumacher. Schumacher.
Schumacher, aye.
Schumacher, aye.
The clerk will close the roll. Representative Davney changes from no to aye. Now we have to do math.
Davney changes from no to aye.
There being 106 ayes and 25 nays, the bill is passed as amended by the Senate and its title agreed to.